On the surface, the topic of sewer surveillance isn't a glamorous subject, but beneath city streets, where the water looks like a muddy river, researchers are getting a clearer picture of COVID-19 in Oregon communities.
You can't hide from wastewater.
Tyler Radniecki leads up the Oregon State University TRACE project, put in place after the start of the pandemic. Researchers are opening manholes to gather samples from neighborhoods. They're also studying samples from wastewater treatment plants.
If you are connected to the sewer line, you are contributing to the samples that we're taking. And so we really do get an unbiased and complete picture of what's happening in the community in a way that still protects individual citizens' privacy as well. So it's kind of the best of both worlds.
Radniecki has worked with wastewater his entire academic career. His team of students and researchers is studying the makeup of the samples they collect and generating data which health experts are using across the state. The goal is to identify genetic evidence of the virus and its variants and locate COVID hotspots.
We go to different counties and collaborate with the local public health department and doing a public health project surveillance to see the prevalence of COVID within the community.
Those samples end up here, labs at Oregon State University in Corvallis. That's where they evaluate the well-mixed samples of wastewater.
When we sequence the virus, we compare the sequences to known variants, your deltas, your omicrons, your BA2s, and when we see that they line up, we then know that that variant is present in the community, and you can have more than one.
Okay. While COVID is of immediate concern, this effort is already evolving to life after the pandemic.
We're already starting to move on to other diseases that we're finding in the wastewater, things such as the flu or cryptosporidium. And as the next set of diseases keep coming through communities that we want to keep an eye on, we know we have a framework to build from, and we can modify it to meet those future needs.
Dr. Kristin Gonzalez is Deschutes County's COVID-19 outbreak supervisor. 3 cities in her county are participating in the project: Bend, Redmond, and Sunriver. Dr. Gonzalez believes this wastewater detective work will go a long way to helping counties decide how best to use their resources.
Part of our job as public health is to be good stewards of taxpayer dollars. We want to make sure that the community is served in an equitable and cost-effective way. And the way that we can do this is by one of our tools is monitoring the wastewater data, because it's a forward-leaning indicator, which tells us what's going to happen, like what's going on. Are the numbers going up? Are they going down?
Right now, one of the biggest challenges is turnaround time. It's not easy to get samples from Central Oregon back to the lab. Researchers are relying on services like overnight shipping.
During a pandemic, the rate of knowledge gathering is huge, and it has to be right now because things are changing every week.